science have brought several effective treatments to us so that we can get rid of the dimpling of cellulite and restore a smoother, more attractive look to our skin's surface.
No needle mesotherapy was developed to address the main obstacle to patient satisfaction with traditional mesotherapy, the needles used to perform the injections. In traditional mesotherapy, a fine-gauge needle is used to inject a cocktail of fat-emulsifying drugs into the fat-storing layer of the skin called the mesoderm. Developed in Europe in the 1950s, mesotherapy has successfully been used to treat the unsightly dimpling of cellulite on millions of women in Europe. Here in the U.S., the side effects of temporary swelling, mild bruising, and patient fear of needles led to the development of no-needle mesotherapy. Today, a small group of leading doctors uses a process called aquapheresis to work the mesotherapy cocktail into the mesoderm from the skin surface without any pain, swelling, or needles. No-needle mesotherapy requires no downtime or recovery. Patients are often treated over their lunch hour and return to normal activities immediately. Ask your doctor for more information about painlessly treating your cellulite with no-needle mesotherapy.
Cellulite is a change we're all familiar with. It's sort of like tuck and roll upholstery, where there are tacks and rolls, and it's where the fibrous bands pull down on the fat layer and create globules of fat that look like a wavy appearance on the skin surface. About 80% of all women have some degree of cellulite. In traditional mesotherapy, small amounts of natural materials are injected into the superficial fat in order to change the metabolism of those cells. And what it does is it improves circulation and reduces the globules of fat. In this no-needle mesotherapy, we take these same materials and use an electrical current to drive it down into the tissue painlessly and effectively to alter those same tissues.
Cellulite is a condition that affects literally millions of women of all shapes and sizes. Although some men suffer from cellulite, it is generally something we women have accepted as part of life. It is just one of those unflattering conditions we try to hide or cover up. Advances in medical science have brought several effective treatments to us so that we can get rid of the dimpling of cellulite and restore a smoother, more attractive look to our skin's surface.
I can't tell you how many times a day I hear, what's the best cream for cellulite? What can I do? What machine works? What's the hype? What's real? What isn't real? Finally, we have something that can be applied without pain, without discomfort, medically supervised, clinically proven, that we know works and will make a big difference.
No needle mesotherapy was developed to address the main obstacle to patient satisfaction with traditional mesotherapy, the needles used to perform the injections.
In traditional mesotherapy, we use needles to inject small amounts of naturally occurring substances down into that layer in order to change the metabolism of those cells and to reabsorb some of that fat and to improve circulation.
Today, a small group of leading doctors uses a process called aquapheresis to work the mesotherapy cocktail into the mesoderm from the skin surface without any pain, swelling, or needles.
In no-needle mesotherapy, we use an electrical current to drive those same chemicals down into the tissue, and we do it in a way that is painless and causes no bruising or injury whatsoever.
What we do is we take this applicator, which has been filled with the mesotherapy solution, and we basically just roll it onto the skin. And what makes this very unique is the mechanism of action. And that's basically using what's called aquapheresis, or you're using water to actually penetrate into the skin, combined with a little laser in that individual area. And as you can see, it's not the least bit painful. In fact, for a lot of people, it's very, relaxing.
No needle mesotherapy requires no downtime or recovery. Patients are often treated over their lunch hour and return to normal activities immediately.
You're allowed to go out and enjoy being outside without worrying about seeing bruises and irregularities in the skin from the treatment.
Dermal Wave offers an opportunity to do the same type of therapy, deliver the same chemicals into the fat without the needles. Obviously less painful, less possibility of hitting blood vessels or any other structures. For myself, I'm much more enamored with the idea of putting this across my fat pad here, actually a little smaller one, but across my fat pad here, and injecting the chemicals there to get rid of the fat pads under my eyes, rather than putting needles in there. I don't want the pain, I don't want the bruising. So I'm thrilled with this idea.
Patients will be excited to see the difference, and that's what our practice is about. We've made great strides in so many other areas, and now finally we can make a big difference in cellulite.